Hello, I'm Paul Slauson, doctoral student at Concordia University, St. Paul, and I wanted to do my research proposal. And what my research proposal is the effects of resistance training on older adults, comparative study. And I'm doing my EDD and exercise physiology. So just to do some introduction to it, so the whole aim of the study is to explore how resistance training can positively impact mental health on older adults. So there's been some research already on older adults and mental health and how this can be improved, and hopefully this can be incorporated into certain fields like just assisted living or just the general older population. So there's been a lot of current trends that mental health can be positively impacted, like self-efficacy, for example, or anxiety or depression. So those are some of the trends that there are currently. But there are gaps. So the gaps would be that there wasn't a lot of research on group exercises and how this can increase social interactions between other older adults, because that might be lower in that population. And also specifically using resistance training, because there's a lot of research on exercise as a whole, a lot of aerobic training, but not a lot of resistance training. And maybe because there's a stigma that that can be a lot of injury prone exercises, when that's not particularly true if the population is really observed and trained correctly. So the whole question or problem statement is shown in older adults in that age range, 60 to 70. How can resistance training affect mental health compared to a group that doesn't do any resistance training or any exercise at all? So, talking about the participants in the study that I would do, first, the staff of an assisted living home would help me find the correct participants, ones that are, I would say, relatively healthy, but really the big thing is there's not a lot of mobility issues, so they can participate in the study properly. And then we would probably take 10 participants, and we would get seven male and three female, and no loss in the course of the study. So that's what the participants are. So instruments that we're going to use is really a survey. Seems like the easiest instrument to create and the cheapest. So in the survey, there would be three questions: one about depression, one of anxiety, and one of social interaction. And we'll probably talk about it a little later, but how it will be done is we would do a survey before the study and then after the study to see what sort of differences there would be. And there would be a scale from 1 to 5 of, how much the feelings of depression or anxiety is and how much social interaction they're getting. 5 being lots of it and 1 being I'm just by myself. So with the reliability, I would say that it would be high because it would be easy to replicate this study by just using the same survey and the same kind of participants within the same age range. And I believe the validity would only be lowered, or it probably would be impacted by the truthfulness of the survey. So those that maybe are more depressed than they would let on the survey, that could probably hurt all of this. And maybe they think that they're not as social as they actually are. Maybe they're lowering, or they're, you know, kind of undermining their score there. So with the procedures, like I was kind of talking a little bit about earlier, how the staff would kind of do a lot of the help with the participants. They would also help with administering the survey, so they'd be able to give the survey out to the rooms of the participants that have been selected and asked to complete it in that day while they have time and it's fresh on their mind. and they would also be the ones to collect it as well and give it to me, the investigator, and they would be responsible for that. Now, the actual procedure, the actual exercises, I chose a pool. I think resistance training in a pool would be easy on the joints still of the participants, although there is risk involved in a pool, but this hopefully can be mitigated by a personal trainer that would be or is going to be at the facility. We would do training for 8 weeks and do that every other day um, and not every day. And it would be just mostly large muscle groups. All 10 participants would exercise as a group so we can have that question of social interaction. Hopefully, they have that perceived increase or they understand, they make friends and everything. And then the it would be 30 minutes for each session for 8 weeks long. The exercises would be light to medium um, intensity. So we're not going all out or anything or doing high intensity interval training. It would be just pretty much light to medium um, intensity, and then that would be the overall procedure of the actual training sessions. For the actual data and analysis, I wanted to use a paired t-test or paired sample t-test because we have a pre and post survey results, so we have to have that for both ends, and we'd have a linear regression analysis to show the overall impact of resistance training in the study. The independent variable for this is the resistance training. The actual variable we manipulate is that. And then the dependent variable or variables would be the three different aspects of mental health that we're trying to measure. So practical applications for this would really hopefully be that other facilities would be able to use this study to demonstrate how impactful resistance training or hopefully just exercise in all does to mental health in a positive way. And hopefully this can be implemented in other other residents in other facilities. And also, I would think that this can help just the larger older adult population, people that are retired, and they are just kind of sitting around and not knowing what to do, and they are declining in mental health. And hopefully, showing these group exercises not only helps with the physical health of skeletal muscle and bones, but also mental health. So hopefully this contributes to the body of knowledge of mental health and older adults in relation to exercise. Um, some may know about the positive impacts of exercise on our physical body, but what about our mental state? And hopefully, what this will do is maybe it'll increase social interactions with older adults, and they may be lacking in that. Um, so there are those sort of things like that. Um, and then also actually the prior slide, hopefully practitioners and other medical professionals can see this study and use this in their recommendations to their patients. Now, limitations that I saw or would foresee in this study would be the participants. So in this age range, we may have a lot of participants that are not mobile enough to participate in the study, or if they do, they may have a lot of joint pain, or maybe there are some range of motion limitations, and this could impact the amount of participants, or maybe it'll be harder to find the 10 uh, participants, or maybe more, depending on the study that wants to be replicated. So it may be hard to find those as well. Other limitations could be that the survey was answered incorrectly. Maybe the survey could ask about feelings of anxiety without defining it clearly, and this could be confusing. Um, or when I put things could be forgotten, maybe the participants just forget to answer the survey. And so, out of the small amount of participants we could grab from a facility, maybe even of those, they may forget to do the study or the survey and even forget to go to the pool area or wherever the resistance training classes would take place. So those are some of the limitations I'd like to outline. Recommendations for further research. So I think doing this study, it did highlight other areas that could be highlighted. So things like other kinds of resistance training. We're doing resistance training in the pool, but what about maybe machines? If it's done safely, maybe free weights again if that's done safely, things like that. So there's different kind of resistance trainings that could be explored, and also maybe the younger adults within the age range. So staying in the early 60s, and that could help explore different kinds of resistance training because they may be more mobile. Uh, Other studies should explore other aspects of mental health. I went over, in depression and anxiety, but there are a lot of different other aspects, and maybe we can explore a longer term effect than just an 8 week training session. Maybe we can do 16, or we can just have more of a longer study that shows how long this can be impactful and whether the participants continue to exercise on their own with the group of people they started the study with. So the conclusion really is that the study should show that resistance training improves mental health, and it could also improve their social interaction and self-efficacy. So this would just show that resistance training does indeed um, improve mental health, mentioning the null hypothesis, and then it also will show that that these three aspects of mental health increased, but just these three alone. And here are my references that I used as well. So hopefully this is a good proposal, and thank you guys for listening.